Hey there, thanks for taking the time. Dr. Barry Reid here at Mason Spine and Injury Center, Greater Cincinnati area. Today we're doing an article review. This is on the effectiveness of chiropractic-based care for low back stiffness and or pain, chiropractic versus physical therapy. And I thought this article was interesting. It's by Dr. Nima Kodakarami, and what they wanted to do was to see for low back pain based cases if physical therapy was more effective than chiropractic therapy or vice versa. And what they found was very interesting. They found that chiropractic therapy, if the practitioner identified the cause of the low back pain, muscle, disc, joint being stuck, nerve, combination thereof, if that was identified, the chiropractic care was in fact much more favorable, and as they term it, economically feasible. So for us, all of us, if there's an issue with having low back issues, typically it starts with something that we do, and then typically it will go away or improve over the course of a few days and sometimes a few weeks, maybe even a couple of months. And then typically if we do something else, physically demanding type activities, working in the yard, picking up a piece of furniture, sitting in a car for extended periods of time, which tend to happen much more in the summertime, it seems, then sometimes those symptoms return. What this article says is that the sooner we address it, all of us, including me, the easier it is to overcome it. And that chiropractic care is effective. And it works, and it does. Also, it was interesting that in this article on page number 2 was that this doctor found that, quote, low back pain is the second most common reason for visits to physicians in the US. And this is a medical, this is from the National Institutes of Health, a medical-based journal article review from the NIH, National Library of Medicine. So when it says that low back pain is the second most common cause of visits to physicians' offices, I wonder what the medical people are doing for this. I can only assume that there are medicines given, and so be it. But if the cause of the pain is not identified and the medicines cover up the pain or the symptoms or the inflammation, then the likelihood of that returning after the symptoms go away is what? When you're ready to identify the cause of the symptoms of stiffness, soreness, pain, dullness, aching, having more difficulty than you believe that should be present after sitting in a car for a while, and instead of being able to get up like this, we're having to do this thing, please find someone who can help. This office does free consultations every single day. It doesn't matter what your healthcare coverage is. It doesn't matter if you have health insurance or not. If you call our office, I will be happy to speak with you one-on-one to determine and help both of us know if you may have something that chiropractic care can help. So call us, please. Again, thanks for taking the time. Dr. Barry Reid, Mason Spine and Injury Center here in the Greater Cincinnati area. Take care.